Women perceive pain differently than men and also experience higher chronic pains levels, which are strong and enduring. Women's pain is usually downplayed and disbelieved by doctors and other healthcare experts rather than being taken as a true medical issue. Women's pain is addressed with psychiatric diagnosis such as anxiety or stress. Because of this, women are often given sedatives or other ineffective treatments and not proper treatments to control pain. One of the key reasons behind this is the pain research has classically focused on men physiology, and thus women's experience of pain has been under researched. For example, disease like heart disease present differently in women and therefore may be misdiagnosed or treated too late. Women are also at higher risk of having chronic pain disorders like rheumatoid arthritis, but go undiagnosed or inappropriately treated. Women are also forced to wait longer than men in acute conditions for pain relief, which not only causes them physical hurt but is also emotionally traumatic. It can lead to long term suffering that proves to have a negative impact on the quality of life. The underlying cause of the issue is systematic bias and perception of women's pain. The health professional should recognize that the pain of women is the same as that of men, and care should be provided to the individual patient, not on the basis of gender assumption. More studies are needed to know how women perceive pain and respond to therapy. By addressing these imbalances and giving more equitable treatment, we can improve pain care for women, ensuring that they are, receive the proper care they deserve.
Unintentional racism refers to discriminatory actions or attitudes that occur without conscious awareness or intent. It's often a result of implicit biases, those subconscious beliefs or stereotypes we hold about different racial or ethnic groups. Even individuals who genuinely believe in equality may unknowingly perpetrate racist behaviors. These biases are shaped by societal influences, media, or past experiences, and they can influence how people interact with others, often without realizing it. In healthcare, unintentional racism can appear in many forms. For example, a healthcare provider may make assumptions about a patient's health based on their race. A doctor might assume that a black patient is less likely to afford certain treatments, or a Hispanic patient might be dismissed when expressing pain, assuming they're being overly dramatic. Another common example is when healthcare staff uses microaggressions, such as speaking to a patient in a simplified tone because of their ethnicity, or making assumptions about their level of education or language proficiency. These biases can significantly impact patient care. When healthcare professionals unconsciously stereotype patients, it can lead to a misdiagnosis, delayed treatment, or suboptimal care. For instance, if the doctor assumes that a black patient is at higher risk for certain conditions, they might overlook other potential diagnoses. Additionally, when a patient feels judged or misunderstood, they may be less likely to trust their healthcare provider or share important health information. This lack of trust can hinder effective communication and ultimately affect treatment outcomes. If patients experience unintentional racism, it's crucial that they feel empowered to voice their concerns. Many healthcare systems have formal complaint processes, often through patient advocacy departments or other services. Patients can also speak with a supervisor or a different healthcare provider if they feel uncomfortable. Additionally, some hospitals and clinics have feedback surveys or online portals where patients can report issues anonymously. It's important for healthcare systems to foster an environment where a patient feels safe to speak up without fear or retaliation. Medical professionals should also receive training to be aware of implicit biases so they can make a more inclusive environment for all patients.
Sexism and racism determine health. The data shown in our coursebook is outdated, so we have considered researching and studying how some of the facts have changed over the years. Women's health is compromised as they live longer, so they are more exposed to become disabled. The rate of sexual abuse is higher than in men. Their symptoms are less likely to be understood by practitioners, and their illnesses, like chronic fatigue syndrome, are less studied. They suffer complications in pregnancy, especially in very young mothers, and safe sex leads to HIV disease. They're more prone to depression and anxiety, and breast cancer and cardiovascular diseases are leading killers of women. According to the KFF's 2023 survey on racism, discrimination, and health, in multicultural nations, minorities suffer a long-standing structural and systemic inequities rooted in historical and ongoing racism and discrimination. These minorities are usually underemployed, which translates into higher poverty levels, limiting their access to quality health care and lowering their life expectancy. For indigenous people, they have less access to the health system, they face racism and discrimination, which leads to higher rates of depression, alcoholism, suicide, and violence, impacting the new generations. Studies show that in 2021, women lived 5 years more than men. Life expectancy for women was 73.8 years and 68.4 for men. This chart shows the differences between females and males. We want to call your attention to focus on the fact that in 1950 in Rwanda, Africa, women live only 1 year more than men, whereas in 2023 it increased to 4.4, getting close to developed countries. Let's study some data from a developed country. In the USA, in 1950, women lived an average of 5.61 years more than men, 0.61 years more than in 2023. Some of the reasons why females live longer than men are accidents, drugs abuse, tobacco, and chronic diseases. By looking at this graphic, it's easy to understand that your birthplace will determine your quality of life and life expectancy. This difference in health and life expectancy between countries is a matter of social justice. Reducing health inequities is, for the cognition of social determinants of health, an ethical imperative. Social injustice is killing people massively.